All right, here it is, our very first episode of the Doc Talk. I'm Dr. Manzoor. I am board certified in family medicine, and this is Dr. Hai, also board certified in family medicine, and we both practice in the same office. So, for our very first episode, our very first topic, we're gonna talk and elaborate more on the rant you posted earlier today about the difference between traditional family medicine model versus the wellness care model.
Yeah, so it's not so much the difference between wellness and family medicine. It's just wellness versus all medicine. Okay.
Okay.
I think that a lot of times when people see all this content on social media, about these wellness practitioner and things that they're offering and them working on lifestyle management very extensively with patients, I think that they automatically assume that that's kind of what their physician is supposed to be doing too.
This is the patients.
Yes, the patients. Okay. And a lot of it comes off like I've seen a few podcasts that actually overall were pretty good, but the wellness, you know, I don't like saying the term wellness influencer because like if you're a wellness influencer, you shouldn't be seeking any kind of healthcare from a wellness influencer, right?
Correct.
Like
Correct.
that's just common sense.
We're talking
I'm
about
talking about
MDs, nurse
yeah,
practitioners, physician
exactly.
assistants.
So healthcare providers who are who are in the realm of health optimization is the better way to put it. Is what the correct way to do wellness is. And so the podcast about health optimization will often mention, well, when you go and you get your lipid panel done, they're going to check this, and this, but your doctor's not going to check this, and this, and this. Now, whether they're saying this maliciously or not, the person who's hearing it, what they hear is, oh, so there's things my doctor could have checked and he or she didn't check them. And so it creates this distrust in healthcare, which is a huge issue on its own right now. And it makes them feel like their doctor is not doing what they're supposed to be doing.
So basically, what I'm understanding is that there are two different realms. There's the health optimization, longevity, let's make you feel your best realm. And then there's the other realm where you have your primary care provider, you go for, let's say, blood pressure management, diabetes management, that kind of stuff.
Right. So there's disease management, which I think is the role of your doctor primarily, like your regular doctor that you go to. Okay. And the truth is that the role of the doctor could and should embody all the wellness things too. In an ideal world, your doctor would be doing all of that. You would talk about disease
So why don't
management.
they do that?
Right.
That's the biggest question that we
Exactly. So
get.
you would talk about disease management, you would talk about lifestyle management, and you would try to manage most diseases and provide extensive conversation and test all the extra things that are out there and consider experimental medications for people who are good candidates.
What kind of experimental
But
medications?
that's a whole separate podcast.
Okay. Okay.
but
Okay. Some other day we'll talk about
but
that.
do you know how long that would take?
Oh
Well, what do
yes.
you think a good thorough visit would feel like?
From a patient's perspective or a
From
doctor's
as a
perspective?
physician, how long do you think you would need to have to be like, you know what, I have educated this patient in the way that I should have, they totally understand what I told them, I answered all their questions, I helped them come up with deficits in their diet that they can fix to help their chronic conditions, I went over supplements that they can take that would be beneficial to them. I talked about hormonal abnormalities that could start to exist at their age and what all the options are and what the risk factors for those are and what the benefits are. How long do you think you would need to have that conversation?
If I were to tell you the honest truth, if you want a in-depth, personalized care, 60 minutes at the
At
very
the very
minimum.
least, right?
Because
Mm-hmm.
not only are you going to be counseling them, you're going to first gather a history and check up on them. How are things been, all that kind of stuff. Go over their medications, look over their other chronic
Yeah,
diseases. I mean,
you
there's a
have to do
lot
disease
of stuff you
management
have
first, right?
because that's
Exactly.
exactly
Yep.
correct.
So you do the disease management, and then you talk about all the wellness stuff that can be done and the wellness things that you could provide them. Okay. So A, it would take you 60 minutes.
So
B,
what is the barrier then? Why aren't we doing 60-minute visits? What's going on? Why are we doing 30 minutes, 15 minutes? What's happening?
because of the way that physicians and healthcare providers are paid. So healthcare providers, and now at this point, within the U.S., most is owned by large healthcare corporations. Very few doctors are still running their own offices, and so the doctors are being paid by the healthcare system. The healthcare system is being paid by insurance. Insurance pays you per patient. Okay, and so in order to be able to sustain a hospital system that's that big, and then be able to pay all their physicians, imagine the number of patients that need to be seen. And so if a healthcare system needs to see X number of patients, those are going to need to get divided up between all the healthcare providers that work over there, essentially. And so the general requirement at most healthcare places and most clinics is you get 20 to 30 minutes per patient. And that's not 20 to 30 minutes of clinical care, like you sit in front of the patient and you talk for 20, 30 minutes. No.
So what are we talking about
That's
here?
20 to 30 minutes of the patient arrives, they get checked in, they get their vitals done, the nurse assessment done. Then the nurse comes and tells you you're going to see the patient. You do the whole history collection, you do the physical if necessary, you come up with a plan, and then you come back and you document that entire thing. You either dictate it or you type it.
So you're telling me that, and this is true, obviously, I'm also a practicing physician, but so you're saying that we get 30 to 20 minutes not to just sit there and discuss the patient's care,
No,
but
but for that entire process. to
everything,
occur. Yep.
your notes included,
Yep.
ordering images, labs included, the vital,
Reviewing
the
their old
grooming.
labs, if they've seen specialists in the meantime, reviewing all of those notes, reviewing any ER visits they may have had. God, we're not even talking about complex things like hospital follow-ups. I'm just saying your day-to-day, somebody's coming in.
So if you're just given 20 or 30 minutes, there is no way
No,
that
absolutely not.
health optimization, longevity,
All of that can be built into it,
hormones,
Yeah.
there's no way we
No,
can
it's
incorporate
very
that stuff.
difficult. And so here's the thing. I do have some patients that are actually incredibly healthy. Like, we really don't have much to discuss in terms of disease management.
Okay.
But they still come for their 6-month follow-up. Maybe they're on one medication, but really they're doing really well already. And these are your patients that already have made their lifestyle modifications. I have this female patient. She's in her early 50s.
Okay.
And she's already started to do the big things, like making sure she's getting all the correct macros, she's getting enough protein, she's doing resistance exercises to keep her bone density
That's the core
strong.
pillar of
Exactly.
the foundation.
Exactly. She is she's intermittent fasting.
Okay.
She is making sure that her weight, her muscle mass, all that
So
stuff is
basically, you're saying she has all of her lifestyle
she has it
modifications
already
down.
exactly. And
down
so
to
every
a
time
T.
we have a visit, we literally talk about what you would probably talk about at a wellness clinic. We talk about, hey, you're doing all this and it's going so great. What else can we do to optimize you?
Okay, so
what are things that we can reach, right?
I see.
So if a patient like that comes to you, right, and when she comes to me, there are things that we can do. Now, even within that, I'm still constrained because she would really benefit from starting some testosterone gel. Okay.
Testosterone
And we've
female,
discussed
okay.
that. But the problem is that her insurance won't cover it.
It definitely won't cover it.
Yep.
I don't even think they even have formulations.
No, there isn't. You
for
have to get them
women
made at a
testosterone.
compounding pharmacy, okay? And costs can vary based on the pharmacy you're going to,
Okay.
So even though she is all she meets the criteria of the perfect patient for a wellness clinic,
Sure.
right? But despite that, I still have insurance constraints.
So now you're saying there's a second barrier.
Exactly.
So the first barrier was we are limited to a certain amount of time.
Mm-hmm.
Now you're saying the second barrier is even if we had the opportunity to practice the wellness medicine
Mm-hmm.
on the perfect person, the insurance companies will not cover a certain medication.
Yeah,
that
medications, labs. The number of times that I get kickback because I'm checking somebody's ferritin. My God, like it doesn't. Fatigue is not a diagnosis that
vitamin
I can use.
D levels are another
yeah,
one.
Vitamin D levels. I think everybody should be on supplementation. We shouldn't really be checking them.
Sure.
But so ferritin, I've used fatigue. I've used sleep abnormalities. I have literally used restless leg syndrome as diagnosis, and
that's a very difficult lab to cover.
Yeah, and I haven't gotten coverage.
Through insurance company unless there's an actual anemia going on.
Yep, exactly.
If there's an anemia, then 100% they cover the iron panel.
And right? I haven't gotten coverage for a lot of it. And so the people who have gotten it covered, when we've trended their ferritin and started them on iron supplementation and brought those numbers up, it's made a big difference in their lifestyle.
Oh, there's of course I've spoken to several hematologists that say if you keep your ferritin 70 or above,
yep, it makes a big difference.
That can make actually a difference in the restless leg
syndrome.
syndrome.
The next question is, well, why don't you just start everybody on iron supplementation, right? Why do you need to check the ferritin if you know that ferritin is it needs to be high?
That is a valid question. That
right. But the thing is that iron is not harmless. Nothing is harmless. Like you shouldn't be taking stuff if you don't need it. That is correct. Right? You can have iron overload. Iron causes constipation. Constipation causes bloating. Bloating
can start getting deposited in other areas.
Exactly. Yeah. Bloating will give you stomach aches, and when you have a stomach ache, that affects your mental health. Like you can just go down this vicious cycle just because you took something that you didn't need to take.
Correct. So that's why you need to be able to order the lab.
Yeah. To be able to monitor
these things. So the insurance companies are huge barriers.
A huge barrier. And again, so I say this, right? So, how are they checking at the wellness clinics? Because the patients, let's be honest, the ones that are going there are ones who can afford it. You know,
That's
we've
correct.
always had, you think of wellness clinics almost as concierge medicine. We've always had this. Concierge medicine has always existed. You can always go and get an executive physical done for, 10 grand, and they'll check every single molecule of your body. It's not that we don't have this testing available, and it's not that
So
everybody should have access
it
to it.
costs extra money,
It costs a
basically.
lot of money.
It
And
costs a
if
lot
you
of
can
money.
pay for it, go for it. Pay for it. Again, there's lots of good wellness providers out there. But the truth is that most people can't. And those people that can't still need to be able to access
So,
healthcare.
bottom line from today's podcast discussion, it's not that your regular doctor is not wanting to check something or isn't wanting to do a deep dive. It's that their hands are basically tied,
Yeah.
either by the healthcare system
Mhm.
or by the insurance companies.
Yeah.
Sometimes even the pharmaceutical companies, I would say too.
Yeah, and a lot of times by the fact that in today's economy, most people don't have dispensable income to be able to purchase half the supplements that are available to purchase.
That's
You
correct.
know, I have had patients literally tell me I cannot get this inhaler because I only have $14 left for this month. So like that's the that
And that's a medication that they need for their asthma.
right.
That's not a let's optimize
Right,
some
exactly.
fitness
So
level, right? That's
so
a medication.
unfortunately, wellness medicine is not for the average American. It's not. It's unfortunate, and it's another consequence of the extreme capitalism. But
Yeah.
it is what it is.
Well, thank you for elaborating more on this concept.